The physiological risks of using medical cannabis are very few, as the medical marijuana doesn't actually affect the heart or lungs of any patient. So risk of overdose or death is very nil, as compared to maybe most prescription drugs that other people might otherwise use. So that sort of risk is very few. The biggest risk that most patients face actually has to do with the legality of cannabis federally. So not knowing someone's rights is really the biggest risk, in the sense that if you don't know how you can carry it in your state, or you don't know how to use medical marijuana properly, you run the greatest risk of being prosecuted either by the state, local, or federal governments. Other risks that can happen are susceptible mostly to psychological conditions and may involve patients that are already susceptible to bipolarism or schizophrenia, which can be triggered by medical marijuana use, and that's definitely something any patient, if they have those conditions, should talk to their doctor about before starting a medical cannabis regimen. Additionally, we never advocate smoking. We certainly recommend vaporization or eating cannabis as a better alternative for patients, as smoking can damage the tissue around the bronchial passages and cause inflammation and issues with the carcinogens that come from just simply burning cannabis. So just like smoking cigarettes, we don't recommend smoking cannabis as opposed to vaporizing, which is a much safer method of consuming cannabis.